Youth incarceration has soared in New York City over the last 2 years. Between 2021 and 2023, the number of juveniles being held in detention nearly doubled from 987 to 1,775, causing serious overcrowding issues, which also led to a fiery exchange during the City Council's criminal justice hearing Friday.
The program was cut because we were informed that they already had an existing impact program, and that one didn't get up and running.
There is no alternative to the impact program. There is nothing like impact that operates in the city of New York.
I disagree.
Well, you said there's an alternative. So let's hear from your deputy commissioners. Was there an alternative? What other services are being provided to these young people? Because all you were doing is sending them to jail.
All right, so the city's corrections officials were in the hot seat all day on Friday. Leading the questioning was the chairwoman of the City Council's Criminal Justice Committee, Brooklyn Councilwoman Sandy Nurse, who joins us this morning to discuss the future of Rikers Island as well as other issues plaguing the city's jail. So, Councilwoman Nurse, great to have you here to talk about this. All right, so we saw right there the Juanita Holmes, the Assistant Probations Commissioner, was grilled, really, from you and other city council members about the alternative to programs to keep younger folks out of jail. Are you saying there's no alternatives to begin with?
So one of the main things we took away from Friday's preliminary budget hearing for the Department of Corrections and Probations is that the administration is just not fully focused on safely drawing down the jail population, and it's not making use of the tools and programs it has at its disposal, such as alternatives to incarceration. These are programs that divert young people from the island in the first place. These are workforce development programs, mentorship, family services. They're meant to get young people on the right track. We have seen a rise in youth detention, and that's come as there have been cuts to these programs. Similarly, we saw with corrections. Corrections made a $17 million cut last year to programs at Rikers. These are programs that do workforce development, help people get housing, reentry services. And so when we're seeing these cuts to these programs and the jail population grow up, there's not an alignment here. And so this kind of budget and management decision-making can't happen, can't continue to occur given the humanitarian crisis in our juvenile detention and Rikers jails.
Yeah, like you said, the issues that you see in juvenile facilities is the same at Rikers. The new corrections commissioner also spoke Friday. What kind of improvements did she talk about?
Yeah, so one of the other main takeaways from the hearing was that the Department of Corrections really still needs to focus on staff management and deployment issues for the safety of everybody, both detainees and staff on the island. We have seen 30 people die over the last 2 years. We see people not getting to their court and medical appointments. There are a lot of people working at Rikers, but not enough people in the positions of highest need. So we don't have people assigned, officers are not at their jail assignment posts, they're not doing tours properly. We're seeing a consistent breakdown of protocol when it comes to addressing instances on the island. These are safety protocols that exist for their safety and the safety of everyone there. So we need to see stronger accountability for making sure everyone is safe at Rikers, and we should be focused on drawing down that population to support staff in keeping everyone safe.
Yeah, just a question on the programming, because those are programs to get folks who are already incarcerated back on their feet, but what are the things being done to prevent them from committing a crime and being arrested in the first place so you don't have to worry about the jail numbers and the programs?
Absolutely. I mean, look, over the last 2 years, we've seen cuts to social services. We're seeing library service close down. We're seeing cuts to CUNY. We're seeing cuts across the board to the public social safety net that is meant to prevent people from getting into situations. So the fact that we are seeing cuts to programs to divert people, young people particularly, from the island in the first place is a huge problem, and it's counterproductive to the goal of safely drawing down the jail population, which we are required to do to close Rikers.
Yeah, and according to the city doesn't have enough money, and they're not going to reach the 2027 deadline. So where do we stand then on borough-based jails, since, I mean, Rikers is supposed to be closed in just a few years?
Yeah, well, I mean, we saw Commissioner Jiha announce a new projected cost. We don't have any concrete financial assessment or detailed assessment of where that number specifically is coming from, and it's certainly not reflected in the budget proposal as it exists. But the main priority should be that we are investing in the programs and the services that helps us safely draw down the population. We should be investing in social services outside of the jails that prevent people from getting there in in the first place. And and really, there is a clear roadmap. There are clear strategies that have been identified. The mayor could be putting a real effort to work with stakeholders across the court system to address case times, for example, to bring down the time for processing, for evidence delivery, to get people to court, to their actual court appointments. That's a consistent issue where we're lacking. So there are a number of strategies that we could see being employed that simply are not being utilized.
So what's the next step then, right? You had the hearing, you learned a lot of information about what needs to be done. What's the conversation that happens with City Hall to make some of those changes? Are you confident there will be?
I'm really hoping that the executive budget reflects the needs and the goals of getting people off the island, of getting people safely back into our communities, coming up with long-term plans for the care of people who are coming off of Rikers. I think it's important for your viewers to know and be reminded that over 53% of the population at Rikers has a mental health issue, 20% severe mental health diagnosis, 40% of the island has addiction struggles. So the majority of people at our city jails need long-term plans for care, for support. They need a long-term solution, and I don't think we're investing enough in that.
All right. Well, thanks so much for coming in. We appreciate your time this morning.
Thanks for having me.
Yeah.